Good evening, everyone. Welcome to Prime Talks, a one of a kind initiative by Voice of Healthcare, where we bring forward the visionary from all walks of the healthcare. And joining me today is Dr. Nirmal Surya, President of Indian Stroke Association. Welcome to the session, Dr. Surya.
Namaskar. Thank you very much, Mr. Naveen Nishchal.
Thank you, sir. Thank you very much. So, first of all, many congratulations on taking over the charge of ISA as president. Sir, neurologist is a rare breed, and many of them coming together, working together for one cause, stroke. Being a physician myself, I understand why stroke is important. Stroke being one of the largest killers in India, and every year we witness more than 2 million stroke cases, and out of which more than 200,000 patients die because of stroke, and many of them suffer with post-stroke morbidity. So, before I talk about ISA and its objective, I want you to lay down the current landscape of stroke in India and how it is different from Western world. Over to you, sir.
Thank you very much, Dr. Naveen Nishchal. You are a physician, so you know that how important stroke is. As we are today in 2024, we know that it is the second leading cause of death and the third most leading cause of disability.
Yeah,
The stroke in developing country is increasing, while the incidence of stroke in developed country has reduced for a period of time. As you know that Southeast Asia forms nearly two-thirds of the world population,
right.
and the incidence of stroke in this Southeast Asia is nearly 40% of the burden of the stroke. And India alone, the incidence, though we do not have a generalized study to say that whole India, but there are scattered studies coming from, say, west, south, east, and it clearly says that anything around 140, 150 to 170 or 100,000 is really the incidence of stroke per year.
Right.
Now, problem is that after the stroke, one third patient gets better completely.
Oh,
One third remain with a mild to moderate disability. But there are
right.
one third who are left out with the severe disability. And therefore, we need to have a chart for these people that how we can prevent this disability and could match now to the West. You know
Right.
that most important five risk factor of the stroke is hypertension. And I know of when there are patient comes with the stroke, I know that first time they recorded the blood pressure when they got the stroke and they
Yeah,
found out that it was high. And
absolutely.
there is so much of ignorance of even checking a blood pressure once in a month, once in 6 months, or once in a year. And there are people who think that they are completely all right and can never have hypertension or diabetes. So,
Right.
blood pressure, the diabetes, the obesity, smoking, our dietary habits, and now the environment, the pollution.
Yeah,
India is a highly polluted country, and there are cities where the pollution is very high, AQI about 300, 250, and this further increases the risk of stroke. And
yeah,
therefore, the plan should be not only treating the stroke, but should be starting from the right from the beginning, the prevention, the early detection, early treatment, and the long term rehabilitation. So, end to end therapy should be available to every citizen of India.
right. Understood. So yeah, I mean, India is as a country we are facing a huge challenge, and every day because of air pollution, it's a new considered factor which is adding to these new cases of stroke. And
I also want to add here that
yeah,
if you look at the stroke, there are two kind of stroke. One is
yeah,
ischemic stroke, where the circulation or the artery get blocked, and
correct.
another is a uh,
Hemorrhagic,
hemorrhagic stroke, where the
yeah,
artery ruptures and the blood comes out.
yeah, yeah.
80% of stroke are ischemic stroke, and the
Okay,
20% of stroke are hemorrhagic stroke, nearly in India.
right.
But in India, there are another condition which comes, and that is the cerebrovenous thrombosis. So this
Okay,
causes a hemorrhagic infarct. So it is
okay,
a infarct which is hemorrhagic, a mix of that, and that is much more common in postpartum, in women with oral contraceptives, anemia, dehydration, fasting. So it is a new condition which has been much more prevalent in India, need to be diagnosed early.
okay,
Fortunately, they are completely reversible if treated in time. Not
okay,
only that, India has certain other risk factors. If you look at the gross data, the stroke in India is 10 years younger than compared to the world, and that's
okay,
an alarming.
right,
And there are other diseases like tuberculosis, infection like dengue, which could also give rise to a ischemic or a hemorrhagic stroke. So we
yeah,
really need to look at all those etiological factors
yeah,
beside the blood pressure, diabetes,
yeah,
obesity, smoking, alcohol, uh, other causes like infective vasculitis, etc., etc., to come over the treatment of this stroke.
yeah. So we are. It means we are at higher risk than Western counterpart. Yeah,
Exactly.
understood. So, Dr. Surya, like you have recently taken over ISA as president, and Indian Stroke Association is an association which is working only for stroke. So I want to
Exactly.
understand how old is this organization, and what are, I mean, if you can let me know high level some key aims and objective of Indian Stroke Association. That
Right.
would
So
be great. Yeah.
Indian Stroke Association is not a very uh, long organization. So it's about 10 to 15 years old.
Yeah.
But we have grown. It is the second largest organization in India of the neurologists. As Indian Academy of Neurology, there are 3,500 nearly neurologists are member. Indian Stroke has 1,200
Wow.
neurologists and the physicians which are members. And
Yeah.
it has been growing.
Yeah.
So every year we have more and more number of neurologists or stroke specialists joining our organization. The president of the organization is a real huge task, and I'm really honored to lead the 1,200 stroke specialists, and I really hope that by the time I leave it should be 1,500 in a year's time. The key aim of Indian Stroke Association is the education, the education to the doctors, physicians, our own training, our own practicing who are practicing for more than 5 years so that they can uh, update their knowledge,
Right.
training for the people who are under us. So we have a lot of training courses. So ISA has recently with DNB now has a fellowship 2 years program which is going to start across the country. So that's an important decision and progress. Then awareness, because if anybody get a chest pain, he get alarmed. No matter what it is, he immediately go to the nearest hospital, do a ECG, and see a doctor, get admitted. But if anybody get a stroke, he's not alarmed because there's no pain.
Yeah. Yeah.
Therefore, awareness about the early warning symptoms of the stroke is so important, and
Yeah.
be fast is something which we are working on. And then, of course, services to community.
Yeah.
How we are going to keep community know that what is happening, what are the new things are coming, how people will know that there is some drug available. If we can use within 4.5 hours of stroke, we can completely lyse the clot. And for those who are not got better after thrombolysis, we can
Yeah.
even get the clot removed from the brain and get them better. So these are the area where we have to go into this. and finally to create an atmosphere where these people can take long-term rehabilitation about the education and services on that. So these are some
Un-
of the uh,
Understood.
you know key point which ISA would like to do in coming
Yeah,
years.
understood. So, Dr. Surya, you rightly pointed out that these are the key objectives of ISA. When uh, when we talk about healthcare professionals or health facilities, the way myocardial infarction, heart attack is being, given preference or weightage. Stroke is not given that much of weightage. Whenever there are two patients in an emergency, one is of myocardial infarction, and another one is stroke, or even for that matter, not let's not even compare it with myocardial infarction or some other patient. I have seen in my when I was practicing, although my thesis, my during my post graduation days, my thesis was on cerebral infarction itself, and I understand the value of time. Time is really an important factor that we have to get immediately a CT scan done. We have to rule out hemorrhagic kind of a stroke. But when it comes to emergency officers, paramedics, they are not that much sensitized that we have to act quickly whenever there is a stroke patient. So I want to understand how and how you are working on, especially on those um, paramedics and emergency doctors, hospitals, how we are making them stroke ready hospitals. Suppose
Okay.
there is a hospital in vicinity which doesn't have CT scan, or some hospitals might have CT scan, but some they don't have CT scan. How should they treat that kind of patients, and how should they take that patient seriously?
See, as you rightly pointed out, the neurologists are coming, new young neurologists are coming. We have doctors who have passed out in 80s, 90s, 20s, and their training was then had no idea about the stroke because they never ever been able to see the stroke at that time. Because when I trained in say 79, I passed my MBBS, 84 I passed my MD. Stroke, we do not have CT scan, so we
Yeah,
were do the lumbar puncture, and if the CSF is normal, we'll treat as infarct. If
Mark,
CSF
okay,
is hemorrhagic, we'll treat as a hemorrhage.
correct.
Irrespective, we have no idea that if hemorrhage is not connected to the subarachnoid space, we will not get. So,
Yeah,
if we have given the heparin, patient might have died. So, our
yeah,
concept of stroke has never gained at that time. The
correct.
neurology has advanced in past decade so much that
Yeah,
those who have passed out before,
yeah,
they not realize that stroke can be treated.
correct.
When I joined in 84, the neurology, that concept was if a stroke, 15 days, let him lie down in the bed.
Yeah,
And today we are getting the patient out of the bed in 24 hours. So the
right,
whole concept has changed. And therefore, it is very, very important for us to make the neurologist, let leave the neurologist, physician, and general practitioner sensitized about the early treatment in the stroke. And what ISA has done is they have tied up with the quality accreditation of India, and we now are more than 50 assessor has been trained who has been the assessor, and we are accrediting the centers which are stroke ready. So by
okay,
now we have done 21 advanced center, and we have more than 20 applications pending for their accreditation. And similarly, the primary centers are not yet coming, and that is where is the crux. We
right,
need to have, if we have 21 advanced center, we should have had 100 primary center, because
correct,
if we can train those primary center and get them to understand that if the patient has come with suspected stroke, and if the CT scan is normal, they can give the thrombolysis within 3 hours or to 4.5 hours time under the supervision. So
right,
that government of India, all the district hospital have a CT scan. So it is not that in rural area the thrombolysis cannot be done. In
Yeah.
fact, most cardiologists at all across the country inject the thrombolysis when they suspect the heart attack only on ECG. So
Right.
our ECG is CT scan. It's a counterpart. So you have
Yeah.
a ECG, you see the leads going showing QS
Right.
pattern, you know acute infarct, you thrombolize. So
Yeah.
similarly, if our patient comes with anything like speech disturbance, visual disturbance, hand weakness, leg weakness, imbalance, when we
Right.
suspect stroke, we do a CT scan, and if CT scan is normal, we should thrombolize immediately then and there. And I think here the government has to take a lead. We are happy to train these people, and
Right.
district level thrombolysis should be done as they were doing for the cardiac
Okay.
uh, attack. And we should not call the stroke, we should call it as a brain attack,
Brain
because
attack.
otherwise people realize that this is an attack in the brain. Because after the heart attack I can still go to my office with a little breathlessness and work, but after
Yeah.
the stroke I may not be able to even walk, I may
Walk.
not
Yeah.
be even able to go or talk and write. So my life is in a matter is like useless. So
Yeah.
I think this should be taken very, very seriously, and we need to send this information to everybody. Do not take the brain attack lightly.
Lightly.
Call it a brain attack, because
Right.
your brain has been attacked by the blood supply, and you can't allow that damage in the brain. And time is the brain, because every second the millions of neurons are dying. So you
Right.
cannot just sit and
Yeah.
wait, doctor is coming. You have to act fast.
Yeah. So, like in myocardial infarction, we have to save myocardium. Here, we have to save neurons. Yeah,
Exactly.
it's a new
Exactly.
insight. So, I remember during my PG days, I have thrombolized many myocardial infarction patients. And although we used to read that we can thrombolize infarct patient, but I couldn't get a chance to, or I couldn't get a mentor or a neurologist to teach me that how to do that. So here I want to understand: do you need a neurologist to supervise thrombolysis process, or simple physician can
It-
initiate the process?
see, see, we need to have some training, because there are stroke mimics. We need to have
Okay,
certain guidelines.
right,
We need to understand the blood pressure level. We need to understand previous surgery in past 2 weeks, the platelet count, the blood
risk
pressure
factor,
level,
risk factor.
the sugar. So we
Yeah,
need to have certain protocols which need to be ticked. We need to
right,
measure the NIHS scale before you thrombolize. So there are certain protocol which need to be followed. It is not that blinded that you give it, and therefore we are happy and ready to train. And we are going to create a system where we are going to make an app. Now telestroke is so common, it is very useful. Even a
yeah,
district level person can send us the patient story on the
right,
app along with the CT scan, and one
right.
of the neurologists or stroke specialists from the ISA could guide them immediately. So
Wow.
initially it will help them, and
Yeah.
they would understand that they can do it, and this is possible. And I think I'm going to take this forward, and I hope the government take this seriously and give an opportunity to us to create this atmosphere where more and more number of people can be saved from the stroke.
So this is I mean, wonderful initiative. I think ISA is using technology and creating an app to help district level doctors. This is really wonderful news for us, and I think with this initiative we can save a lot of lives. So I think it's a really good step. So Dr. Surya, while we spoke about hospitals, district hospital doctors training, ISAs, has plans to start all these initiatives and already working on these initiatives. I want to touch upon a bit about community. So, like you talked about five, six risk factors, and hypertension is one of the main culprit uh, amongst all. And I have seen that in general public, whenever first they will never go for checking of their blood pressure. Even if they check and if it is high, they won't go for treatment. Even if they go for treatment, they will take it for a week or 10 days, and there is no adherence at all amongst general public. And I think this is more of a cultural issue, because in India, this is in our culture that we have to be away from allopathic drugs. Allopathic drugs are harmful. If we take it, it can harm our body, and this is, to me, I think this is a cultural issue. How
Exactly.
ISA, how ISA is
Yeah.
going to address this? You being president of ISA, I'm sure you must be thinking that how you are going to take this challenge.
See, Naveen, you have put up a very blind question. Today, I saw few patients with a stroke, and two patients has blood pressure of 150 by 110. I told them that your blood pressure is high. One of them is a patient with a stroke already, heart attack. He said, yes, my blood pressure is not coming under control. Maybe I came walking, so blood pressure is high. Another person tell me because I came to you, sir, when I go to doctor, my pressure goes high. So this is what is the concept among the people, that I have come to doctor, so my pressure has gone. As if doctors are the one who are giving the patient the blood pressure. But one good thing has happened, Naveen, in last couple of years. Now we are able to do the 24-hour BP monitoring. And I think
Yeah,
that is something which I explained to the patient, that, okay, you may have come to me and your pressure is high or your stress or whatever it is. But one good thing you do now, do the 24-hour BP monitor. If your BP in the sleep is high, then you have no stress of coming to the doctor or walking.
yeah,
Please take your medicine, because then you need to control your blood pressure. That means your pressure is high. So now I'm all those patients who come to me and their pressure is a little bit high, I tell them to do the 24-hour BP record. So that helps. Now what I have started and what is going to happen is, we are creating, in each zone we are having a training program for the physicians. So my first training session start on 12th May, and we are going to do it in a second tier cities. So it is in the, and in a city or in a state where there's not much of awareness. So we are doing first session at Varanasi. So
okay,
what we have done, we have invited about 200 physicians from the nearby Varanasi districts. We are
correct,
going to sensitize them about the stroke, right from the prevention to early detection to the early therapy to the rehabilitation.
right,
Now that will go simultaneously. Beside that, what we are going to do is, we are going to call the patients.
right,
So we will have a 2 hour session with the patient, understanding their problem and their caregiver's problem, and we will start talking to them and understanding them and how best we can do. I have been doing this support group meeting for last 4 and 5 years regularly ever since 2018. I'm also the president of Indian Federation of Neuro Rehabilitation, and neuro rehabilitation is in my heart. So I
yeah,
always look at the ways how I can reach out to the people and get them the best. So what
right,
we are going to do is, we will promote the support groups of stroke, try and use the social media. We are coming out with a system or a program which is known as each one teach one. So
okay,
one patient who got a stroke, he should teach one person that
correct,
if you get the stroke, what is to be done and how you prevent, because they are the best ambassador. They have suffered.
absolutely,
They would be
absolutely.
happy to let other people safe
On the
rather
information,
than
yeah,
suffer.
yeah,
So these are some of the programs which are we are going to do. World Stroke Day, what we will do this year is, we will do a competition among the medical students and other students, IITs, the science students, so that they come out with the ways to create an awareness on stroke and how the stroke prevention can be done, be it how to stop the smoking or how to take the regular walk, how to motivate people to do the exercises and control their diabetes, because even diabetes is a silent killer, and it
right,
can affect the kidney, brain, eyes,
yeah,
nerves. So we need to really formulate, and person has to understand and follow the strict diet and lifestyle measurement. We also will involve some of the channel like yoga, meditation, and they are also useful in helping both blood pressure, diabetes,
yeah,
and regular controlling the things. So
yeah,
these are
yeah,
the ways how we are going to create an awareness for general public. And social media is very powerful, and we hope that we are able to infiltrate that to reach out to the common man and make them understand that stroke is more dangerous.
yeah,
Early pickup, time is the brain, and
yeah.
go to the stroke ready hospital to get the appropriate treatment. No point going to a cardiologist and get admitted and waste first 24 hours when that
Yeah.
is the prime time you can be treated.
Yeah. So window period is really very important. I understand.
Exactly. Exactly.
So, I mean, I think these are wonderful initiatives, Dr. Surya. While ISA is working with public doctors, and I'm sure you being president of ISA, you have a lot of things in your mind going on mind that at policy level, while government is working extensively on non-communicable diseases, at policy level, what do you feel are the key challenges, and how are you going to address those challenges with policy makers? So what are your different strategies to address, because if at policy level, even a finer tweak can impact the entire community, entire public.
I think,
So what are
yeah.
those challenges, and how are you going to address those challenges, Dr. Surya?
See, my first thing, I feel that the government has got a lot of priorities, non-communicable disease at both national level as well as at WHO level is on top priority. They've been working, but I strongly feel that stroke has to be out from the NCD. You cannot link stroke with diabetes and blood pressure and other. I think stroke should be taken as a serious, and we should have a stroke policy which determine that stroke should be taken as a high priority. I think government will have to think on something because the disability after the stroke is very high, and you cannot allow that. So I always, even at WHO I spoke, I said stroke should be taken out because what is going to happen is large number of people are having diabetes and everything get diluted into that. You are concentrating on that, and by the time you come to the stroke it is left alone. So stroke has to be given a priority because brain is what you have, a top level functioning organ, and you
Yeah,
cannot compromise on the brain. That's number one.
yeah,
Number two will be the government need to have strengthen the district hospital, and
yeah,
therefore training of the physician at district level and getting them trained for the thrombolysis and early detection and treatment is going to be the key. And it is, there are maybe some districts which are really doing good in terms of thrombolysis, but it should be at par at all the states, at all the district hospital, and the physicians should be trained. This would have a regular sensitizing and capacity building program. ISA can help them out in doing that. Number three is awareness. If you have a district hospital which is ready for thrombolysis, but if patients do not know that where they have to go,
yeah,
then there's a problem. So we need to create an awareness, and I think government need to have some sort of a person who could create an impact. Somebody like Amitabh Bachchan or somebody
yeah,
who had a stroke, and he
yeah,
can tell the people that look how I got better because of this early thrombolysis, which will have an impact in the society. And fourth, building up the rehabilitation centers. We do not have rehabilitation center. I
yeah,
did a survey last month and I asked 100 stroke specialists how many of them has rehab in their center, and it is less than 20%. I think each and every stroke center has to have a rehab unit, and government need to stress upon that. If you have taken for lost the train to catch
yeah,
in early part of the thrombolysis,
yeah,
you still have rehabilitation to get better and come back to the work. I think
yeah.
these are the three or four things which I feel that government could take a stricter decision, make a policy. It may not be possible in one day, but if step by step can be done, which is not very difficult, it is just that they have to prioritize it and take it forward.
Wonderful, wonderful, Dr. Surya. I think we had a really wonderful discussion, and we are. I mean, time is short. I mean, we are about to end this session. And I really enjoyed this conversation, Dr. Surya. And as we conclude this enlightening session of Prime Talks, I would like to thank you, Dr. Surya. Thank you very much for your participation and commitment to advancing stroke care. Thank you very much. And I would like to thank our viewers who are watching us online. And we will soon be back with another session. Thank you. Thank you very
Thank
much.
you very much.
Thank you.
Thank you.
Thank you.
Namaskar.